It's time for the final session of today, titled Digital Solutions in Mental Health. Well, we have the moderator with us in the studio. Piotr, why mental health out of so many conditions to which such solutions may be applied? Why did you pick mental health? Well, mental health is the part and parcel of our health. It's underappreciated by decision makers and very often not respected by us. We know today that digital tools and solutions may contribute a significant value. We've been discussing with Artur for years to introduce on the agenda of the forum a separate discussion panel, and COVID has forced us to do so. Because we were told by very different people that locked up at home, stuck at home, we are confused, we are losing our bearings. So this has motivated us to put together a wonderful team. And please tell me, mental disorders, mental conditions, is their treatment easier thanks to those technologies? Perhaps they are predestined for new technologies. I think there is a number of areas, and we are going to touch on it while this session continues. Many topics which may be easily managed, easily addressed. But this ecosystem, well, we haven't analyzed it yet in this context, so we are putting it on the public agenda today, and this session strives to introduce to the Polish healthcare system long-lasting institutional solutions that will support mental health. So, Piotr, over to you. You take over the reins. I think we have wonderful speakers today. I would like to introduce them now. And I would like to ask our technical team to show us, all participants, the keynote speech will be given by Anna O'Donnell of University of Pavia, of UFA. So I've said before that there will be many topics related to public health, and you will see during her lecture to what extent public health is linked to mental health. In sequence, Anna O'Donnell will be followed by Magdalena Czarzyńska-Jachim, the Deputy Mayor of Sopot, who has inspired us to pose this question, and you will learn why in a minute. Later, Magdalena will be followed by Marek Krzystanek of the Medical University of Silesia, who is the pioneer in Poland in the area of mental health. So first, he will give his presentation and later join our discussion. The discussion will be joined by Grzegorz Saj, the director of the Department for Mental Health at the Patient Ombudsman's office. He will be joined by Marek Balicki, the former Minister of Health, now overseeing the nationwide mental health care program pilot implementation. And finally, we will have Monika Zamarlik, a member of Patient Advocacy Group, a federation assisting children suffering of diabetes. So during the previous panel, we saw available technologies that reduce sugar levels, and you will see how it's correlated to mental health of chronically ill patients. So perhaps we'll start with the first address. A bit traditional, which is why I have safeguarding measures in case of loss of internet connection or blackout. I've asked Anna O'Donnell to record her speech.
It is a great pleasure for me to join this year the eHealth Forum, and I would like to thank the organizer for this kind invitation, and in particular the University of Gdańsk. I'm sorry I'm not able to join in person in beautiful Gdańsk this year, but I hope that can happen very, very soon. I would like to talk about what are the digital solutions for mental health available nowadays. And I'm about to do that with the head of president of the digital health section of the European Public Health Association, EUFA. EUFA, as many of you know, is the umbrella organization for public health association and institute in Europe that nowadays counts on 86 members from 47 countries, bringing together over 25 public health experts for professional exchange and collaboration throughout Europe. EUFA can count on the work of different sections. Sections are organized with the idea of bringing together researchers, policymakers, and practitioners working in the same field for knowledge sharing and capacity building. And within EUFA sections, we have the digital health section, which was funded in 2019. Prior to the COVID-19 pandemic that has dramatically highlighted the urgent need of digital tools that can support healthcare delivery and access to healthcare. Within the work of the digital health section in EUFA, we have published our we have published what we believed should be the path towards public health digitalization across Europe. And we have done that starting with defining a very important funding principle, which is digitalization. We see this as a means, not an end of itself. Digitalization, as we say in the paper, should not modify public health principle, rather it should support and enable their implementations. And in the work that has been published, we have made an effort to list and categorize all the different digital tools that are available and nowadays to support public health action across Europe. And we have, with this, within this discussion, identified 5 digital features which, in our idea, bolster public health action. And these features are the potential for personalization and precision, the potential for automation of public health action, the possibility to predict, which is very important in prevention and more importantly in secondary prevention, the huge potential brought by data analytics, and last but not least, the possibility of support interaction, which puts really people at the center of the process of care. And identifying those features has enabled us to build a theoretical conceptual framework, which is, in our idea, the path towards public health digitalization in Europe. Making it very clear that from a public health perspective, digitalization provides several benefits, theoretical benefits, including supporting the transition from cure to prevention, helping to put people and patients at the center and supporting their empowerment, and making healthcare management and delivery more efficient, safer, and cheaper. So within these guidelines, how can we apply the EUFA framework to mental health care and prevention? And I should say, to stimulate the discussion that will follow within this conference, that this is not the first question to ask. The first question to ask is, why should we do that? Well, we should do that because the global burden of mental disease is huge. mental illness across the world accounts for over 30% of years lived with disability and 13% of disability-adjusted life years, which place mental illness a distant first in global burden of diseases. It is estimated that in the world, more than 700 million people suffer from mental disorders. So there is an urgent need to tackle such a public health concern, and digitalization can help us in doing this. How can digital solution help? Well, the reasoning around how innovations creates opportunity in digital mental health care and prevention has been discussed by the psychiatry world, the public health world, at the research, policy, and practice level. But it is not just important to discuss around the potential of digital solutions to tackle the global burden of mental health in different settings. It is important to identify what is still missing to achieve that. And we have, in the context of the 16th World Congress of Public Health, which took place virtually, of course, last month, we have organized together with the public mental health section in UFA a workshop, a thematic workshop around digital interventions in public mental health, current impact and future perspective, inviting experts from different fields in a multidisciplinary approach. We had psychiatrists, we had public health researchers, and we had policymakers. And that stimulated a very lively discussions around what is still unknown, which evidence is still missing, and which infrastructure are not yet there to support the implementation of mental health digitalization now and in the future. So following up with the questions, perhaps the right questions to ask at this stage is where to act. And so we create a sort of application layer where we put the digitalization of mental health across the whole path of care, which includes prevention, including screening and early diagnosis, which includes proper diagnosis, treatment, monitoring of compliance to treatment, and monitoring of diseases evolution, and also rehabilitation. So it is important to see where digitalization of mental health fits towards the process, the whole process of care, which I would like to reinforce, include prevention. Then, how to act? Which are the tools that are available? And I mean, we don't have time right now to list all the tools that are available today, that will be available tomorrow in a very, very, very rapid evolution. And just mentioning some, we have, for example, if we would like to very, very superficially categorize them, we have the area of digital phenotyping and digital biomarkers. We have the area of telemedicine and telepsychiatry. We have smartphone applications. We have mobile platform-based for cognitive behavior therapy. We have more recent and more modern tools such as virtual reality and augmented reality therapy. We have apps for mindfulness and meditation. So we have, as you can see, some collections here, all sorts of technology, all sorts of digital tools that can support. And the problem here is how to tidy this up, how to identify what works and what doesn't work, and who to target. We can very, very simply say that either we target patients, or let's say either we target people that are put at the center of the process of care, because digitalization allowed there to self-care, for example, allow there to interact with our patients, or we do target healthcare professionals that are supported in the work by digitalization. And I don't see that this is a matter of choice. I'm saying that digital solutions target both patients and people in general, if we talk about prevention, but also healthcare professionals and healthcare organizations. The real problem is about estimating and quantifying impact. There are a lot of descriptions around and offers around digital tools to support mental health care, but very, as I will briefly report on right now, scant evidence on the impact of such tools. We have been conducting some systematic evidence gathering on the different tools that are used in clinical practice and in prevention to support mental health therapy. And to say it very, very shortly, evidence is still very scant, but also very heterogeneous. And we also have to make the distinction between experimental evidence that comes from experimental studies, clinical trials, and systematic reviews of clinical trials, as compared to real-life evidence. What we argue is that both are tremendously important, and we are very, very behind in both evidence gathering. The offer of digital solution is very wide, but the evidence that quantifies their impact as compared to non-digital tools or no intervention, and I have recollected here on the slide some examples with reference to, for example, telemedicine, smartphone application use and impact in different mental health illness, is really scant and does not provide conclusive findings. So it is our job, researchers and epidemiological skills, together with the psychiatry skills, to make an effort to create constructive evidence on different tools, but also on different mental health disorders and diseases. And coming towards the end of this very general discussion about what are the digital solutions in mental health, we come to the problem of implementation. And to call things with the real name, what are the current barriers to implementation? So we have somehow highlighted in our position papers what are the pillars for a successful European strategies for public health digitalization, and the same recollections of pillars can be applied to the field of public mental health. So what we need is commitment from policymakers in the healthcare sector. We need homogeneous normative and regulatory framework to support the use of digitalization in psychiatry and in mental health care. We need technical infrastructure to be adopted also by the National Health Service and not also by private providers. Of course, we need economic investments that can support research, but also implementations and adoption at a large scale. We need research, as we said. We need quantitative research and solid research to support the quantification on the impact of such tools, and we need monitoring and evaluation. The introduction and monitoring of public health digital solution in different settings should be supported by technology evaluation also in the fields of mental health. And last but not least, what we need is training and education. More in general, we need to create the culture of using digital tools in mental health, create culture with psychiatrists, create culture with consumers and patients and subjects and the general population at large. I have reported here on the slide a work on attitudes towards digital treatment, for example, for depression. This is the results of a European stakeholder survey. And if you look at the highlights, you see that the level of acceptability towards digital solutions is still a bit cautious. Let's say there is a preference towards blended treatment compared to standalone digital treatment, for example. Care system is being viewed as unprepared for internet-based treatment, and this was identified as the primary barrier. So the need for proper implementation to create the culture for digital health digitalization at the general population level, but also at the healthcare professional levels. So some discussion points that maybe can stimulate the discussion during the panel that will follow. So to our knowledge, there is a very high potential for the use of digital tools in mental health. And I'm wearing the lens of a preventive person, so I'm saying high potential for prevention using digital solution in mental health, but still lack of evidence on impact and on the definition of health outcomes on where to measure impact. The situation with reference to norms and regulation is still across Europe very, very heterogeneous. And there are many settings and many countries still lacking a solid regulatory framework for the adoption of mental health digital solution. We have to be very aware about commercial interest and look at interest disclosure when we evaluate digital solution in mental health. And we should support, and I'm talking on behalf of UFA and the digital health section, multi-partners collaboration. Digitalization by definition deserves a multidisciplinary approach to use and its full potential in clinical and preventive setting. And this is why the public health community is ready and available to work with psychiatrists, to work with IT people together to understand how we can improve population mental health and well-being. I would like to thank you very much for your attention, and I'm looking forward to the discussion that will follow later today and tomorrow. Thank you very much and enjoy the conference.
Well, thank you very much for this lengthy explanation and introduction to health issues and opportunities for deployment of digital solutions. I hope Anna will be coming back later as we continue our session with her online message. Right now, I would like to ask Magda Czerzyńska-Joachim, the Deputy Mayor of Sopot, to present needs of local governments that you see here and now. Good afternoon. I wanted to briefly comment and present the local government's perspective on technological support for many initiatives striving to assist people suffering of mental problems. The spectrum of mental problems is ever increasing, and we are noticing on the local government level, and mental health has substantial impact on the quality of life. The role of local government members is to create living conditions for our residents to make sure is the highest possible. So it's within our region, we are creating different support systems focusing on mental health. We are providing assistance to different resident groups. But it needs to be said very clearly, what is missing is coordination of various initiatives. There is no information flow. There are no integrated systems that would collate data, that would support complex assistance and complex support. Another issue we're struggling with, while designing projects focused on youth, children or seniors, we rely on grants, and these projects are implemented by NGOs. What does it mean in real life? That those projects are limited in time and they are addressed exclusively to select audiences. Which is why we believe that we need more systemic approach, and this support must be empowered by platforms, databases that enable exchange of information to outreach information with information groups that are in dire need of such support. Why does the local government play the pivotal role in this respect? We are the organizer of the comprehensive educational process. We are in charge of kindergarten, schools up to A levels. In addition, we organize and provide welfare, social assistance, and other types of support. Which is why these are staff members of the local government in kindergarten, schools, day centers, in very different places at very different institutions, providing help. Our employees are the first point of contact, and they initiate the process within which we are supporting people struggling with mental health. The second issue, in addition to systemic support, exchange of information, development of platforms, is providing technology support to people able to provide actual assistance. These may be teachers in schools, in kindergartens, this may be welfare workers, all individuals who are able, with the support of technology, swiftly and aptly diagnose the problem and start and embark on a specialist assistance path. What is missing is a robust information system. I think the pandemic we are all struggling with has revealed a number of new issues. The city of Sopot has been always doing its best to assist and help everyone struggling with mental issues. We have 24-hour-a-day hotline. And interestingly, not only seniors stuck at home were calling us, we had many phone calls from students. We had people who have lost their work, who have lost their bearings in the new reality. So we see that there is a dire shortage of information provided by mass media, other channels. There is a separate program addressed to seniors, and it shows that a central system for information helps outreach people who need assistance most effectively. Children and youths, the priority audience, they are not going to call the hotline, they are not going to visit experts on their own initiatives, and they have plenty of mental issues. It's up to us to outreach them via their smartphones. We have to come up with apps, with solutions that will be available, that will be within their reach, and that will encourage them to use them, because they are haunted by many problems. Thank you very much. Well, we've heard today that support targeting mental health is not only provided by psychiatrists, as there are many other methods of outreaching the right audiences, but we know that psychiatrists are indispensable. So the voice of an innovator, a celebrated Polish psychiatrist, Marek Krzystanek, will follow. Hello, my name is Marek Krzystanek. I'm a professor at Silesian University of Medicine. I oversee the psychiatric ward at Silesian Medical Center. I'm also the head of a section at the Polish Psychiatric Society, so I'm the unquestionable leader of psychiatry in Poland and telepsychiatry. I started my research in this area 17 years ago when this word was fairly unknown in our country. Today I would like to highlight the role of telemedicine in mental health. I understand mental health as the integrity of your central nervous system and restoring it thanks to medicine. It includes different preventive and therapeutic measures whose application includes and may be supported by different digital and telemedic solutions. Poland has many achievements in this area, especially in telepsychiatry. I myself was the author of one of the world's leading telepsychiatry project implemented from 2013 until 2015. It was carried out on a group of schizophrenic patients to prove that telemedical treatment is equivalent to clinical treatment, and we managed to prove the advantage of remote treatment, what was a major success. I am committed to development of telemedicine and telepsychiatry in Poland. I've created a number of telebooks which are available on YouTube and on different websites. I've also created a live app and relax app which may be applied in hybrid treatment, which combines pharmacotherapy with digital and biological impact. Right now, I'm working on CyberDoctor, an app that is going to use AI to support medical decisions of physicians during treatment of patients. I'm working on a very interesting telebook that will be used in treatment of agoraphobia or treatment of different traumas, post-traumatic disorder in patients of different accidents. I'm also contributing to development of a platform assisting people in risk of suicide. Apps made in Poland should be used widely by the public at large, and results should be also readily accessible. I publish results of telemedical treatment in Poland and overseas, what seems to be very much needed in Poland. I think we should design new digital solutions that would integrate telemedical activities undertaken by very different entities to create a one-stop shop. In other words, I would like to create a digital platform that would integrate all impacts, which would be readily accessible for patients. Perhaps we should also consider designing a brand new IT solution that could serve patients and their family members in treatment. It could be also driven by AI engine data mining and analyze voice and sound. Such sophisticated tools could largely and significantly support patients who are seeking help in digital and mobile solutions. Well, thank you very much for your statement, Mr. Professor. I hope that you will stay with us and will join our discussion later on as the session continues. Well, today we are focusing on patient centricity. So all discussions are joined by patient advocates. And this discussion is no different. It will be joined by Monika Zamarlik, who will present. Monika, are you with us? Well, please tell us what are the problems of maintaining your daily mental health when you are suffering of a chronic somatic disease. I know that you have many years of experience in supporting such people. Yes, it's true. Well, diabetic patients, when we are talking about health issues and the health system, they are benefiting from pumps and to our advantage. I don't know if you've seen the previous session because we've touched on this topic previously. And it turns out that even the pandemic, which has taken its toll on everyone and has forced us to switch to teleconsultations and telemedicine, it also verified how diabetic patients approach health. And as it transpires, they are very happy with it because those appointments have become more factual. You don't need to commute. You don't have to travel. Patients are overall satisfied with them.
And when it comes to mental health or mental condition of diabetic patients, well, it still is neglected to a large extent. Diabetes is a problem that impacts also the emotional sphere, and without stabilizing the emotional aspect, you cannot treat diabetes. The diabetes is a disease that impacts the whole family. It changes the life of parents, of partners, of children. It forces us to change our lifestyle into a healthier one, which is a positive thing. However, it requires us to reorganize our lives. It is a burden. It requires certain sacrifices. You need to administer insulin during meals. You need to measure sugar level. You need to give up many things when you're not feeling well. And I'm speaking about diabetes type 1 in particular. So diabetologists started to notice more and more that you cannot stabilize the diabetes without a proper mental state. So no treatment can be helpful if a patient has not accepted his or her condition, if they have phobias, if they have other more serious mental problems stemming out from their diabetes. So patients' advocates have been saying for many years that psychological care and maybe psychiatric care later on should be provided, and a psychologist should be introduced into the systemic approach towards treating diabetes. Yes, we have physicians, we have nurses in the system, and such nurses should also be educators, but most of the time they do not have enough time for that. But they are part of the system. Sometimes we have one who would help a patient plan his or her diet, and psychologists are not there. Psychologists usually appear when there is already a major problem. So basically, they are treated as firemen, and that is not the right approach, because at that stage, the crisis is usually very serious. So there are bottom-up initiatives, as Madam Mayor has said. The mental health aspect is neglected, and it is the NGOs and other bottom-up initiatives that are the only ones that look after mental health. And when there is no project, there is no help. So one of the diabetology centers for youth, we had very good support and tests that were making it possible to ensure early detection of depression. So there were questionnaires that enabled diabetologists to see whether there were some problems also in the mental sphere. So there are motivating text messages that are used by NGOs for patients with diabetes type 2, for example. They motivate patients to control their disease better. And those text messages were also showing the patients that they are not alone with their problem. It was an emotional support, and this project lasted 1 year, and it did show that for those patients it was much easier to stabilize the glucose levels than for the patients that were not part of the system. Angela Ivory mentioned telemedicine for patients with diabetes and for the improved quality of life, and also for the self assessment and also of the patients. And an important aspect of telemedicine in that particular case was support from psychologists. Here in Poland, we do not have that support. Patients expect system solutions that would allow to create standardized tools in order to prevent mental problems. So we want to prevent, and mental problems are almost inevitable. We see more and more that young people with diabetes have depression, phobias. They also make suicide attempts because they cannot accept the systems that they suffer. So once patients have mental health problems, it is very difficult or virtually impossible to receive mental health support within the system. And now, during the pandemic, it is almost impossible to receive such support even as part of the private healthcare system. There is so much demand for such services that patients are left alone. Summing up, I would like to say that we'd be very happy and very grateful to see solutions, digital solutions, that would make it possible to offer standardized diagnosis and prevention of mental problems or disorders. The first element of this chain, or the first link, could be diabetologists, because apart from checking the glucose levels and the effectiveness of insulin therapy, this diabetologist could also see the results of a questionnaire which would indicate that the patient needs support in the mental sphere. And then diabetologists could refer such patients to mental health specialists. And when it comes to young people, children, teenagers, such solutions would be very good and very much expected. There are certain limitations. Well, limitations, these are older persons suffering from diabetes type 2. These persons are not so technology savvy, and there are other people who do not want to cooperate. They have certain emotional deficits and they are not willing to cooperate. And there is one last very particular group, and these are people who seem to have fallen out of the system. These are people who are suffering from diabetes type 1, and they were treated as children and teenagers, and they never entered the system of diabetology treatment for adults. We have quite a large number of such persons. They are only treated by the GP, and if they have fallen out of the system, it would be very difficult to identify them and to make sure that they receive this mental health support. Prevention is always better than treatment, and for patients it is actually essential. it is essential for diabetes to be well treated, to provide mental health support. And let me now address Grzegorz Saj, asking him to tell us from the point of view of patients' ombudsman. So what is your take on the digital solutions in the light of patients' rights? Well, thank you very much for the invitation. Well, thank you for, I would like to thank the organizers of this forum, because you have such a rich agenda and you did find time for mental health issues. So I'm very happy to see such distinguished experts, Dr. Balicki and others. So when it comes to mental health, first of all, I would like to say, to begin with, that we are speaking of solutions that are already there. So we are talking about patients' rights and mental health. And in the Patients' Rights Charter, in Article 6, we have a statement, a provision saying that the patient has right to treatment that responds to the current medical knowledge. So there, we already have it there in the law. We want to improve patients' health in a way that is most acceptable, that is preferable, and it is the smallest burden for the patient. And a few things about mental e-health. So, as an ombudsman for patients' rights, I can say, well, for example, we had a psychiatric ward where Katarzyna, aged 25, was admitted. She was admitted there without consent. She did not consent, so the court had to make a decision. It happened in March. In March this year, we had the pandemic. The judge was not able to visit the ward. The judge was not able to visit the patient. And there, digital solutions were used in order to secure the patient's rights. The court was able to verify whether the decision to admit her to psychiatric ward was justified. So she was interviewed by the judge online in a remote fashion. However, I'd like to say that this is not a standard. We are being informed that patients who are admitted to psychiatric ward without consent find it very difficult to be in contact with the court. So we are living in the 21st century. We are talking about e-psychiatry, e-mental health, while we have problems at this very fundamental, very basic level. A second matter that I'd like to mention is the question of Gostynin. There we have the National Center of Prevention of Mental Disorders, and persons that would pose danger to other persons. So these are sexual disorders and other disorders. These persons are not allowed to own mobile phones or laptops. However, they have the right to contact the Patients' Rights Ombudsman and the public ombudsman. So there we looked for a digital solution that would secure patients' rights from the point of view of mental health, and that would also ensure that their rights are protected. So in Gostynin, there is an e-kiosk, an electronic kiosk, where patients can actually connect with the ombudsman and find out about their rights, about the laws in force. So we are talking about hospitals or prisons, but if we talk about e-health, we should remember about community support. So there it is very important to build both the real world as well as digital relations, and there is a demand for such So this is why, even before the pandemic, we responded to hundreds of calls per day, and right now we are receiving over 1,500 calls per day. So the scale is enormous, and the need for consultation, for help, has increased manifold. This is why we are creating a special database, and we need to create a list of centers, a database of centers and locations, places where patients can actually find support. So we offer a list of locations, of telephone numbers where patients can receive support. This is an electronic database accessible on our website, on the website of the Ombudsman for Patients' Rights. So summing up, from the point of view of the Ombudsman for Patients' Rights, what we would expect? Well, first of all, we propose safe and secure solutions. We are dealing with very sensitive data. We are speaking about mental health. So the Ombudsman for Patients' Rights advocates for these solutions to be inclusive. Madam Mayor said that we are dealing with different groups, patient groups, people suffering from social exclusion, elderly persons. Some people do not have access to modern technologies. This is why we need coordinated activities. We need to access everyone, and something that is of particular importance for the Ombudsman, the activities pertaining to mental health should be a priority for the healthcare system in Poland. We appealed to Minister Niedzielski last week, asking for psychiatry to be a priority for the Minister of Health. One of priorities, of course, and Minister Niedzielski said during a press conference that the reform of psychiatry will be continued. We are happy to hear that, and we hope that the solutions for mental health will be implemented. Thank you.
Well, thank you very much for so many valuable recommendations. And we are switching to former Minister Marek Balicki, MD, who is a reformer, a contemporary reformer. He is transforming psychiatry today, moving it from hospitals to the environment. So can you share with us some insights? How do you embark on such transformation and how to tap into it while digitizing treatment? Okay, your microphone is off, probably. Okay, can you hear me now? Yes, we can. I do apologize. Okay, so good evening. Thank you for invitation. And what I've heard so far, I found it utterly interesting and motivating, because you've mentioned a follow-up on the health reform. It's not only me, it's a whole variety of people who are engaged in transforming the Polish psychiatry. So looking back on what we have done and what we have said today, and looking into the future, what are the outlooks for digitization, for digital support for psychiatry? I think we are embarking on a new phase, a phase where we are going to capitalize on experience from the COVID pandemic, which has added momentum to mental health reforms. And it also seems to me that this reform and introducing the environment model will provide a strong stimulus for swift digitization. Let me explain why. Regardless of technological progress, which is accelerating, the environment model is introducing a different paradigm of financing, and this new paradigm may be a driver of changes in this area. Why? Because first of all, we are introducing an institution which is accountable for organization of mental health care on the primary level, on the local level, and this authorized institution is the local mental health center. There will be 300 such centers all across Poland, and they will be accountable for a specific population, 100,000 people. So, for example, if you are living in the Warsaw borough of Wola, if you know that you are suffering of mental health issues, your local center must provide you with required care. Another facilitator, another factor enabling change, this center will get a piece from its share from the local budget, and the number of services will not be limited. This reform will be tied to introduction of an organizational standard for mental health centers, and this means that all across Poland will be introducing frameworks, operating frameworks for those centers. I have to admit that I've really appreciated, because I've never used it at my center when I was working in the hospital, in the district of Wola. I've never used, telemedical services in treatment of schizophrenia, but I think it's a very strong case of a tool providing its services to a large population, 150,000 people, probably 800 to 1,000 people per 100,000 are suffering of mental problems. So this tool could be very practical, because treatment could become very effective compared to the classic psychiatric care model. So I'm sure that healthcare centers will take keen interest in such services like teleappointments, or teleeducation focused on mental health care, different virtual training sessions. And, it's a great example of a tool that may substantially facilitate our efforts. Today, the Minister of Health has announced that 10% of the country is covered by operations of first mental health centers. Well, the target is 100%, because we want those services to be widely available. And I think this model will be the drivetrain. It will drive the change across Poland. We'll be introducing tried and tested tools. Of course, we need legislative framework adequate to those solutions, and we need to appoint on the national level an institution that will support centers in development of standards, and it will also oversee development of everything we call telemedicine. So let me add, as I'm finishing my statement, and this has been confirmed by numerous studies in psychiatry, in the environmental model. We focus on change of relations. We put the stress on partnership-based relationship between the physician and the patient. We don't want the patient to remain passive, and mobile or IT tools transform relationships, make them more partnership-based. Professor Krzystanek, in his project, is putting the spotlight on deliverables, and they are much better thanks to relationship-based partnership. So let me finish by saying, leaders of the center, we are putting together organizational standards. We are advocating establishment of a nationwide center for development of digital standards in psychiatry, and I'm sure everyone will be very keen to implement those solutions as soon as possible, because this will free up resources. It will enable coordinators to focus on more challenging cases, and I'm sure there will be cases when those tools will be insufficient. So I'm optimistic. I hope that environmental model reform will be continued, and that on the national level will get institutional support and changes will be supported to become widespread. Thank you very much, and thank you for your valuable input. There is a need for institutional support, but meanwhile we are decentralizing everything in psychiatry. Let me just explain. We need to deinstitutionalize and decentralize at the same time. So let me go back to Professor Krzystanek. Please comment and share your suggestions on follow-up on the next steps. What should we do in order to make all those opportunities widely available? Well, thank you very much for giving me the floor. I think politicians have pivotal role to play. I'm talking about the central government and local governments, in order to make the most of such possibilities opened up by technological progress. I think development of telepsychiatry of Poland is largely determined by technology and political decisions. We can achieve actual progress in psychiatry thanks to digital solutions that will personalize, offer great access to medical services. They will fine-tune them to individual needs. And it's fair to say that it's very cutting-edge technology, which combined with AI, it may contribute to a quantum leap in terms of standards of provided psychiatric services. I'm creating apps not only for psychiatric patients, but also for patients who have nothing to do with psychiatry. For example, we are now developing a powerful app with AI engine that will help patients struggling with metabolic disorders. So it may help as a preventive measures, people who are healthy today. There are also mobile solutions based on other technologies. We've heard about them today. So Polish psychiatry is ready. Polish science is ready as well to put ready-to-use solutions on the table, hoping they will be embraced by the Polish government, and hopefully a central institution appointed to focus on this area. I'm ready together to share my experience, to share my concepts and technological know-how to co-design such reform. Well, thank you very much for your declaration, and I will go back to Madam Mayor. Dear Magda, do you see the light in the tunnel? Because you've listed problems at the beginning of our discussion. Yes, those solutions breed optimism, but being realistic, I'm looking at my budget. Mental health and support provided to children, youth, and seniors, because as you know, many seniors are struggling with mental problems. It's my key area of interest. Seniors have special smartwatches that connect to our system. Of course, they have psychological support and counseling, but when I look at youth and children, I'm not optimistic when I'm looking at what's happening now, because we are doing our best to provide more psychological support in schools. But I don't know if you realize that kindergartens have no psychological support, and it's very often the kindergarten where first mental disorders begin to surface in the peer group. And you know it better because you are experts, not me, but this is the first time when mental problems begin to surface, when you realize something is wrong, and very often kindergarten teachers are on their own. They have no help whatsoever. So the time from the initial diagnosis or identification of mental problems in children and youths, time until a professional therapy started is very long, and we know that time is precious, especially in such cases, because the crisis may deepen, and unfortunately, there is no funding available. There is a shortage of psychologists, of educators. Counseling centers are very often ineffective despite major commitment of all stakeholders. So while implementing the reform, we need to keep in mind that those centers must be strengthened, reinforced. We need more support in kindergartens, in schools, and this should be tied to county centers, because I know that the minister has mentioned that that new centers for mental health will be established on the county level. It must be integrated. And some children or youth do not end up in a highly specialist center because they come from dysfunctional families, for example. Well, you know very well what is happening out there. So we need stronger support in school, at the kindergarten. It's the key. It's also the key when you're working with a peer group, and there are many problems haunting peer groups for many different reasons. So you need to educate parents. Very little is done in this respect, and only parents who are committed are benefiting from available assistance, workshops, for example, and parents who are not interested. And very often, you know, this is the reality. We can't force them to do anything. So I'm just arguing that centers that are in contact with youth, with children, should be included in the mental health system to be later, you know, professionally dealt with. Well, thank you very much. One more challenging question to everyone. Do you think that within the existing ecosystem or the newly appointed mental health centers, we will be able to solve problems mentioned by Madam Mayor, or do we need to adopt a brand new approach? Maybe Professor will reply to my question. Well, I think we need a body that brings together experts to decentralize the system on the central level, to adopt a personalized approach to each and every patient. So we will have fine-tuned solutions for everyone, but without coordination, nothing will come out of it. You can't do it spontaneously. Thank you, Mr. Minister. Any afterthoughts? Well, I fully agree with the professor, because it's a very complex system. These are two systems, in fact, one for adults and one for minors. whose medical component is ready, but it wasn't implemented because of the COVID-19 pandemic. There is a special plenipotentiary of the Minister of Health appointed to oversee its implementation. There will be 3 levels: counseling centers, on local counseling centers on level 1, psychiatries and daycare center on level 2 for youth and children. It's a completely different issue and very different profiles, so different structure, different approach. And on level 3, we have psychiatric wards as the final resort.
Medyczny obszaru, bo oprócz tego ma...
That is just the medical part. Apart from that, we have a well-developed network of psychological surgeries, clinics, and there we would need a coordination and integration of the system. So this element, which is being implemented as of this year when it comes to psychiatric care, does not exhaust the problem. And I understand that Madam Mayor, when speaking about this, she had a much wider outlook. That would, however, require coordination between different ministries, and in particular when it comes to children and youth. Apart from the Ministry of Family and Social Policy, we are dealing with the Minister of Education. So we have 3 key ministries that deal with the mental health sphere. Tomorrow, a congress starts, and it will be continued tomorrow, and there educators will speak about these problems using the digital tools.
Dużym problemem, jeżeli chodzi o oddziaływania czy...
Well, when it comes to helping children and youth, there we need legal solutions. When it comes to mobile or digital solutions, well, we need a parent or other carers' consent every time a patient is to be subjected to such a solution. So those patients that need most care, and that is children, are often deprived of care by those who should be responsible for them. Sometimes they have no one who would give consent for the use of such. So when we look at 2020, we should be somewhat optimistic, because if we look back several years, and even if we look at the second edition of mental health program, we would see the difference. If we look back further than that to 2016, there was not even one mental health center. And now, thanks to the activities and efforts of Minister Balicki and others, we have 30 such centers, and we hope new ones will be established. So if we look at the psychiatry help for children and youth, 4 years ago there was no plenipotentiary, no ministerial task force, and now we have all that, and 140 surgeries at the first reference level. So something is improving. It is still not perfect. We have not resolved all the problems, but we should be cautiously optimistic. And we hope that in 2022, Polish psychiatry, both in terms of e-psychiatry and other aspects, may not be perfect, but we shall certainly see an improvement. So it's necessary to coordinate our efforts, and if we do so, we will be happy. Well, an establishment of a general system that would encompass not only psychiatry but also other specialists using artificial intelligence and the augmented reality or virtual reality could actually speed up, and we may be surprised by the pace of developments. And we are happy to see Minister Balicki amongst the decision makers, because thanks to his personal engagement, we can actually make the change more dynamic. We can have an e-revolution, and I am an advocate for that. Well, thank you very much. Madam Mayor, would you like to sum up briefly? I'm not sure if I'm the best person, but let me just say I am not a specialist in terms of treatment. However, I believe that we should develop the system that functions one stage earlier. So prevention is not the word I like to use, but we need to act before serious problems. I'm very sorry for teachers, because today we have primary schools with children that have mental problems. In the past, they were in the middle secondary school, and children have problems with determining their gender, for example, and primary school teachers are not prepared to work with these children. And we need to make sure that they are not victims of violence, they are not abused by their peers. So when I spoke about local authorities and teachers, they're left alone and they cannot cope, they do not know what to do. And sometimes well, the authorities just ignore the problem, so there is no systemic approach. Problems are often neglected, and a lot depends on the director of the school, headmaster, because and of course then there are children who drop out from the school system or the public school system. They are then educated in private schools, but there is a financial barrier. So those children who have problems at school and cannot afford private education have more and more problems. So we have to remember not only about treatment once problems actually are diagnosed, but we should equip teachers and other carers with instruments, with knowledge as to how to react, how to do. We need to prepare manuals, we need to prepare guidelines. It's not for everyone, but they need tools. And right now they have nothing. They feel lost, and they have to search for solutions. Sometimes they do it based on their intuition, and sometimes they simply ignore the problem. I created approximately 100 video books. These are guidelines that would be very helpful to such children and their teachers. But no one is using it, or no one is promoting it. We received grants from the government, but it's all dispersed. It's somewhere on the website. So we need a body that would actually gather all this information about tools, instruments, and materials available, because in Poland there are many things that have already been done, that have already been created, and we could have this core where we could promote activities, promote solutions, and promote materials, such as video books, for example. Well, thank you very much. It seems that we are close to reaching a conclusion.
Te cyfrowe rozwiązania pozwalają wypłynąć zdrowie.
That digital solutions help us promote and highlight mental health. In order to do that, we need an institution that will make the most of good practices, solutions readily available, to build a brand new and wider ecosystem. Well, it seems to me that this should be our goal. Okay, so can we conclude today's discussion with such statement? Yes, but such institution would have to demonstrate initiative and must be able to obtain funding to pursue its activities. Thank you very much for your comments, for your contribution, and I hope that it's not the end, that we'll be making, next steps forward, cooperating with different institutions. Thank you. Thank you very much. I would like to congratulate our guests and the moderator on very exciting discussions, robust conclusions, and, putting this topic on the table in the context of digital reality, tying it to somatic problems, because, they are one